With Body Radiosurgery, we hit your cancer from head to toe with no cutting, no bleeding. We have decades of experience with primary and metastatic, large or small cancers. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are the best results and quality of life. Hi, I'm Dr. Gil Lederman. For a free booklet and DVD, call 212-CHOICES. 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. We're super convenient, Broadway and 38th in Manhattan. Hyperthermia 2. To hit your cancer, call 212-CHOICES. 212-CHOICES for Radiosurgery, New York. For prostate cancer treatment, results and quality of life matter. Hi, I'm Dr. Gil Lederman from Radiosurgery, New York. Our enviable record includes treating thousands with prostate cancer. Critical to every man with prostate cancer and their loved ones is quality of life, urinary and sexual, and great treatment data while avoiding surgery. Treatment here is outpatient, with most insurances, Medicare, Medicaid accepted. First in America with radiosurgery for cancers from head to toe, we have the expertise to hit the cancer. Our fresh second opinion could change your life. For prostate cancer treatment, call 212-CHOICES. 212-CHOICES. Radiosurgery, New York. Super conveniently located in Manhattan at 38th and Broadway, hits the prostate cancer. Call 212-CHOICES. 212-CHOICES to hit the prostate cancer.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
I'm very good, Doctor. How are you?
I am A-OK. We're here with John, Ariel, myself, Dr. Lederman. It's the Radiosurgery Hour. You're welcome to call us at... John, what's that number?
800-848-9222. And we are live, so it is early in the morning.
Well, that's you're live. I don't know. I'm a little bit...
I'm here to wake you guys up.
Yeah, please wake us up.
That's what we're here to do, so give us a call.
Hey, the Surgeon General issued a report. 50 years ago, the Surgeon General issued a report, Ariel. Do you know what that was?
Yeah, smoking's bad for you.
Smoking is causing cancer, lung cancer. That's 50 years ago. And they put a little notice on the side of cigarette packages.
They sure have.
Yes, they have.
And it changed people's behavior. It's kind of like the first time in America, I believe, that people were told certain activity caused something bad.
Right.
So it's really monumental. And this week, there was another notice from the Surgeon General, also talking about smoking. So it's like the 50th anniversary gift. So what is smoking doing? Well, obviously nothing good except for the profits of cigarette companies.
Right.
So most of us don't want to smoke to contribute to the profits, right?
Sure.
I mean, that's not why people smoke.
Yeah, no.
But what are the negative things? What did he say now? And this is all based on scientific data. And actually, it's not new news, but it's news in that the government recognizes that there's scientific data showing that cigarette smoking is known to cause lung cancer and heart disease and diabetes and colorectal cancers and liver cancers and ectopic pregnancy. I mean, think about that. Ectopic pregnancy, Ariel, what's ectopic pregnancy?
You have a baby in another part of the uterus where it wasn't supposed to be
Outside
the uterus in the fallopian tube.
Right, so when you think, we're going to tell people about sex now, so cover your ears if you don't want to hear. So here's how sex works. So the mama makes a little egg, right? And the papa makes a little...
fertilizer for the egg.
Fertilizer.
Yeah, very good. I was thinking other things.
And the egg and the fertilizer...
Have to meet.
They meet. And how do they meet?
Hi,
fall in love?
Yeah.
Huh?
Yeah, they got to meet. They got to find each other.
Well, how do they find each other? You young people know about how...
I'm going to say the correct term would be intercourse.
Intercourse. Okay, so there's intercourse.
Sex.
So let's not use that word.
Okay.
So they're going to throw us off of the radio station. So we're giving a little lesson here for all of you. So the egg and the fertilizer meet. And where do they usually meet?
In the uterus.
They meet in the uterus. Can you believe it? I mean, it's really complex. I mean, you think you have to be nice, and the girl has to wear a nice dress, and the boy has to shave and put a little cologne and flowers and a good dinner, right? You think about all that stuff.
I've been doing it wrong all these years.
Right? Well, you think about that stuff, but
Sure.
in fact,
It's
the center
simpler?
point is the egg coming from the ovary, right? The ovary makes the eggs in the woman,
And it travels down a little tube,
and it travels in a tube called the
fallopian tube.
fallopian tube, and it goes from the fallopian tube into the
Uterus.
and there usually it meets the
Fertilizer.
fertilizer,
Right.
the sperm. That's what normally happens. So can you imagine this? That smoking increases the risk of the egg meeting the sperm in that fallopian tube.
And
what happens when the egg meets the sperm? That's when the embryo starts, right?
Yes.
So you mix up the sperm and an egg, and you have a fertilized egg, and that's
and it
when the
gets
little
bigger
baby
and
starts.
bigger and bigger
And the baby starts growing.
Right.
in a tube where it isn't supposed to be in the first place.
It's not supposed to be there. So, why do you think smoking causes that?
That's a great question.
Well, that's
Yeah,
a great question.
that is a
Well,
good question.
Tune in next week. We'll tell you about that. But this week we're telling you that smoking increases the rate of ectopic pregnancy. What is ectopic? Actually, ec means out of.
Out of.
Right.
So EC is out of. So topic is where it should be. Ectopic is where it shouldn't be. And that's why many women lose their fallopian tubes, because the baby is growing in the tube, and the tube will burst.
Sure. Right.
And it will cause a calamity to the woman. It could even be fatal to
Yeah.
the woman. So can you believe that smoking not only causes lung cancers, heart disease, diabetes, colorectal cancers, liver cancers, and what about this erectile dysfunction? If there's erectile dysfunction, probably the fertilizer distributor is going to be out of business, right?
I imagine so.
So
You need a delivery system.
So it seems like this smoking doesn't like little babies because it's interfering with erectile function and ectopic pregnancy risk. Also, what else does smoking do? So that's the end of the sex lesson today. Sorry if you weren't. If you want more, I actually have to tune into something else. Vision loss, tuberculosis, rheumatoid arthritis, impaired immune function, cleft palate in children of women who smoke.
It's really going against the kids.
It's going against the little babies, okay? Cleft palate increases in your little babies if you smoke. Now, smoking doesn't cause all the health problems in the report. We know that. I mean, if you smoke, you're not going to get all those things. Maybe you'll get none of the things. But you're increasing your odds of something bad happening. And as we talked about last week, the average smoker lives about 10 years less than the non-smoker. And it can take many, many years off your life. It can even be fatal.
So stop smoking if you are smoking.
We would advise to stop smoking today. And if you stop smoking today, you'll actually increase your lifespan. And you're 30 years old. You're not, neither one of you are 30, but let's say you're a 30-year-old smoker, stop smoking, will gain 10 years of life. So it's really a pretty it's a rich dividend.
dramatic.
Sure, that is, yeah.
It's a 40-year-old will gain about 9 years of life. 50-year-old also years of life. So if you stop smoking today, you can gain years of life. You can avoid a lot of these problems: lung cancer, colorectal, diabetes, ectopic pregnancy, erectile dysfunction, liver, vision, rheumatoid arthritis, immune function, cleft palate. So it's pretty dramatic. And this is 50 years after the pivotal 1964 Surgeon General report that said for the first time smoking caused lung cancer. Up to that time, it was not really known. In 1965, 43% of adults were smokers. So you guys don't know the world where you'd walk into a room and there was smoke.
Yeah, I mean, very vaguely.
As a kid.
In our lifetime, yeah.
Well, I can't imagine you, Ariel, saw much smoking. I can't imagine.
I saw some.
Where? In France.
I'll tell you later.
The chimney.
I'll tell you later.
In France. Okay, in France. In 1965, 43% of adults were smokers. Today, 2012, 18%. So it's gone down a lot in the United States. But it's usually rich countries have seen a decline in smoking. Poor countries and middle-income countries, 50% of men and about 10 to 20% of women smoke, and not too many give it up. So smoking now is killing 400,000 people a year. There's plenty of other evidence. There's suggestion that even prostate cancer has an increased risk in smokers. So beware. You can gain many years of life. Stopping smoking pays better dividends than putting your money in the bank. and saves you $15 a pack, and you won't have bad breath, and you'll be around to hear our program for 10 more years, which is a big motivation.
I think that's a win-win all the way around.
Yeah, you can listen to us.
There you go.
Years and years and years and years and years and years.
And if you want to speak to us, you can call in at 1-800-848-9222.
Yeah, we have a new disease for you to talk about today. We have a new disease. Okay, we had a woman come in, and she's a famous athlete. Last week I said what kind of athlete she is, and she was upset that I identified what year when she appeared. But she's a famous athlete. She's 83 years old, and she has a mass on her back. And she has 3 masses on her leg. So what disease has 3 masses on the leg and a mass on the back?
What kind of mass?
A massy mass.
I don't know. What kind of disease?
She had a massy mass. Well, I'm asking you. She had 3 masses on the leg. Each one was maybe the size of a
egg, golf ball.
A golf ball,
There
or
we
a little
go.
bit, or a grape to golf ball.
Okay.
Okay, on her leg, on one leg, the right leg, bop, bop, bop. Like every 12 inches, she had a mass, and then on her back, she lifted up her scapula. She raised up her arm, and there was a big mass. And she went to a doctor, and
Neurofibromatosis.
she was told she had lipomas.
Lipomas.
Now, lipomas are benign, fatty little tumors, right? They don't cause harm to anybody,
Right.
right?
Yep.
Okay, so she was told she had lipomas, but it was bothering her. It was causing a lot of pain. I said, wow, I've seen a lot of lipomas. I haven't seen a lipoma like yours. And 4 lipomas, it's like a fertilized lipoma field.
So, did she get a biopsy? Or
Well, what do you think
imaging?
I would do? Would you think I said, oh, yeah, it's a lipoma? You think
No,
I'd say that?
you want a fresh second opinion.
I want to be fresh and a second opinion. I say, wow, lady, I don't think you've got 4 lipomas. Okay, so we did 2 simple tests.
Right.
Okay, what 2? So we did an ultrasound of her leg, so no radiation, took 10 minutes. And she had what I thought she had, which was varicose veins.
Sure.
She had a varicose vein, did varicosity, so the vein had kind of like pockets, ballooning on her leg. So there was some, and you've seen that in some people.
Sure.
Where a person has varicose veins, and it obviously can be treated if it needs to be, but it was not causing any symptoms. And then this big mass in the back growing out of her back. Now, usually fatty tumors like lipomas are soft and
Mobile.
mushy, right? They're mushy.
You can play with them.
Painless, and this one was hard.
Like
it was
a rock?
painful. Not like a rock. I would say more like something between a rock and a mushy tumor. It was okay. It was between the two. But just talking to a guy who said, I haven't seen a lipoma like this, and it's hard, and it's painful.
Right.
I say, this could be serious, right?
Sure.
Okay. So we got a scan of her back. And this turned out to be an elastofibroma.
Obviously.
Okay, now, have you ever heard about your medical school, Ariel? Tell me about your knowledge of elastofibromas.
They sound elastic and fibrous.
Right. So the answer is, even I've seen tens of thousands of patients with tumors. Even I have never seen one. Okay? So number one, we made the diagnosis. So now she knows she has an elastofibroma. She knows, she can look it up, and she's probably listening today, and she has gone on Google, and I've investigated in the medical literature. Well, she knows what she has. It could be a locally aggressive tumor. It can be painful, can erode through tissues, and there are different treatments. Some people may need no treatment if they're watched diligently. We now have a scan of her so we can watch and compare. We can send her for surgery, which is one option, to remove it surgically. Another thing I spoke to her about was actually doing radiosurgery to try to obliterate it non-invasively with pinpoint treatment. So she's contemplating all the options, from doing nothing to doing surgery to radiosurgery, which is just 5 treatments. You come in, boom, get a treatment, we hit the tumor, and a few minutes later she gets up and hopefully goes out shopping at one of the big stores or lunch, or continues her normal life. So she's a remarkable woman. She's kept her body in perfect shape. She's 83. She has a body of like a 20-year-old. And she prizes her health and her body, and we think it's fantastic. So she has the correct diagnosis. She's investigating all the options, which is exactly what we want, people to investigate the options and then make a decision about what treatment they would prefer to have.
And that is what a fresh second opinion does.
That's what it's all about. It's not going back to the old doctor and say, look, doctor, I didn't have this. No, he made a mistake. Unfortunately, he made a mistake, and we're not all perfect. Even me, I'm not all perfect. Just